Hello, I'm Dr. Satheesh Kumar. I'm the Medical Director of Leicestershire Partnership NHS Trust, but I'm also the Caldicott Guardian for the Trust. In my role as a Caldicott Guardian, I protect the patient information within the Trust, and in a way, I act as the conscience of the Trust in protecting patient information. But it's important to remember there is also another role within the Trust, which is a senior information risk owner called CSIRO, which is my colleague Adrian Childs, the nursing director. And it's important that as Caldicott Guardian and as CSIRO Adrian, we work very closely together to make sure that we are managing the information within the Trust well, protecting the patients as well as actually making use of the information appropriately. Information training is absolutely important. We need to make sure that all our staff are trained in about how we use patient identifiable information, and it is equally important that we apply that knowledge on our day-to-day practice. What are the Caldicott principles? Number one, before we share an information, we need to understand the purpose of the information sharing. It's absolutely vital, and we only share patient identifiable information when it's necessary to do so. Where it's not required, we should avoid sharing patient identifiable information. And where it is important to share patient information, and the minimum information should be shared, and it should only be shared where there is a need to know that particular information. And it's absolutely vital as staff working within our trust, we make sure that we share information following these Caldicott principles. And everyone who come across and handle patient identifiable information should be aware of the Caldicott principles as well as the information governance principle, and we should all follow the laws related to the information governance. It's absolutely vital all of us have good knowledge about how we handle patient identifiable information and how we need to make sure that we follow the appropriate information governance legislation. It is important in this context that we all complete our yearly mandatory training, which is available as e-learning on information governance, that helps us to follow the latest information governance standards when we deal with patient information. Where you are not sure what to do, and there will be a number of situations where the situation would be very complex and it is difficult for you to take decisions on your own, by all means please contact the information governance team. They are there to support you, give you the right information as well as take you through some of those complex decisions. I talked about protecting patient information, but we are working in an environment where we are working with a number of organizations. I'm sure you are aware of Better Care Together and our Sustainable and Transformation Plan, where we as an organization work very closely with primary care, social care, as well as UHL. As you can imagine, the timely and appropriate sharing of information is very vital in making sure that the patients receive the right care. So it is important that we share information appropriately as well, and we have to do that without much delay.